afternoon. We met again for another interesting episode of your favorite oral health corner. Today we'll be looking at a very important topic, pericoronitis. Are you in your late teens, 17, 18, 19, or your early 20s, 20, 21, 22? Now, the pericoronitis is just basically inflammation of the gum around the teeth. So if the gum around the teeth gets inflamed, you say you have a pericoronitis. Now what happens, usually the wisdom tooth is one of the stubborn teeth in the mouth. When it is coming, it presents a whole lot of pitches. Now, when the wisdom tooth is coming, and that is why I earlier on mentioned the age bracket, because they are the worst hit, they are the worst affected. At that time, your wisdom teeth are coming. So when the wisdom teeth is coming, sometimes before they come out fully in the mouth, or when they are partially erupted, like we are seeing here, the gum behind grows to cover it, food and other things packed in the space provided, like we are seeing here, then attract microorganisms, then the place becomes inflamed or infected. Now, also remember that there's an opposing tooth, because there is teeth up, and that teeth also comes to bite on the flesh more, causing more trauma to the already traumatized flesh. And this presents with a severe pain. The pain usually radiates through the ears and then the throat. And it disturbs sleep. It also becomes very intense when one is chewing, and also when one closes the mouth. So when you see some of these things and you are within the age bracket I mentioned, you know that your wisdom tooth is coming, but it is not yet in place. Now, after this signs and symptoms, we'll look at the causes. And I've already even mentioned some. The cause is that the wisdom tooth is coming, but it is not yet in place. So it is lower in the plane, and for that matter, the flesh behind can grow and cover. Now, it is two things. Either that wisdom tooth will eventually come, or two, it can come. If that wisdom tooth will eventually come, that means that with time you'll be free, because it will grow into place. But there are most of the cases where the wisdom tooth is being blocked by either a tooth or a bone. We call it impaction. So let's look at this one. This one is trying to come, but hasn't come fully. But if you look at the image here, it tells you it is impacted. So that can't come at all. There's a bone blocking it. And once this bone is blocking forever and ever, the gum will be growing, covering here, food will pack, microorganisms will be attracted there, and then infection will be caused. The upper will also come and traumatize it further. Now, this type of impaction, we call it the vertical impaction, but it's still vertical, but cannot come because there is a bone here, but the X-ray here, there's a bone blocking it. Now, we have other form of impaction. We can talk about also the mesioangular impaction, where a tooth is actually blocking this tooth from coming. So you realize that the other one, we saw only a bone, but this one is a tooth that is blocking it. So this one will not be able to come. It will partially grow, and then the gum will be covered like we are seeing here, and the trauma will keep on from time to time. Let's look at this one. This man is comfortably lying here, horizontal impaction. So this tooth will not come out at all. It's comfortably, it might not even be seen in the mouth. Look at the flesh here, this one will not be seen. So even the potential for this one to cause that pain is minimal, because it will not even come in the mouth at all. Then we also have distal angular. So you realize that part of this tooth is seen here, but this tooth surprisingly has isolated itself. So it is looking somewhere, but part showing in the mouth. Look at the X-ray image. You realize that this bone here is blocking the entire part. So there's a bone blocking. So this one will never and ever be able to grow fully. And it will be causing you the severe pain from time to time. Now, when this thing comes, what do we do? The solution is simple. Just visit your nearest dental clinic and speak to the oral health professionals there. One, per the assessment, if the tooth will come, they will manage the pain and the infection by giving you antibiotics and painkillers. Don't go and buy your own things because you don't know what is appropriate. Then in other instances, they might do deep cleaning to clear off the infection around that tooth, and then probably flush it with antimicrobial mouthwash to make sure that the infection is cleared, and then you'll be placed on medication for you to be fine. We also have this surgical option called the operculectomy, where the flap covering the tooth is cut off, because this is the reason the pain comes. So if you cut it off, then the pain will go. So you will see that here they've cut it off and then the tooth is standing alone. So there's no flesh again covering the tooth. Then we also have the surgical extraction, where the tooth causing that problem will be taken off through from the bone, and then you'll be free forever, and the place will also heal nicely, and then you get your freedom. And these problems are peculiar with the lower wisdom teeth rather than the upper. And if you have it, please don't sit in the house. There's a solution for you. Kindly subscribe to our social media handle, YouTube and Facebook, on your health corner, so that you get more videos.